This is the last video in a series on Helicobacter pylori and will discuss treatment. In the absence of treatment, Helicobacter widely is believed to persist for life. All patients who have tested positive for Helicobacter pylori infection should probably be treated. Treatment involves the use of drugs to reduce stomach acidity together with 2 or 3 antibiotics. Drugs that reduce stomach acidity are used because a less acid environment helps to heal the damage to the stomach lining, and clearance of the bacteria is more likely in a less acidic environment. The commonly used drugs to reduce stomach acidity are called proton pump inhibitors or PPI. Examples are omeprazole, pantoprazole, among others. Then we have another group of drugs that reduce stomach acidity, which are called potassium competitive acid blocker. An example is vonoprazole. The commonly used antibiotics are clarithromycin, amoxicillin, metronidazole, and levofloxacin. First-line therapy means the combination therapy that the doctor uses when the Helicobacter pylori is first diagnosed. Triple therapy is 3 drugs at one time, which means a combination of 1 drug that reduces stomach acidity and 2 antibiotics. Listed here are the commonly used triple therapy. One is a combination of pantoprazole, which is a drug that reduces stomach acidity, and 2 antibiotics, clarithromycin and amoxicillin, which are given for a period of 2 weeks. Another combination is vonoprazole, which reduces stomach acidity together with 2 antibiotics, clarithromycin and amoxicillin. And this is a shorter course of only 1 week, but it is more expensive than the first combination therapy that I've mentioned. Successful treatment means the doctor will confirm that the Helicobacter pylori has been cleared or eradicated by doing a urea breath test. This is done at least 4 weeks after completion of triple therapy. The good news is that clearing the Helicobacter pylori will clear the gastritis, heal the stomach ulcers, and reduce the risk of stomach cancer. Between 70 to 90% Helicobacter pylori has been cleared or eradicated. In patients who fail first-line therapy, the doctor will switch to second-line combination therapy. There are many different combinations of second-line therapy, and many doctors use the antibiotic metronidazole. One popular combination is a combination of 4 medicines. It's called quadruple therapy, and in this combination, there is bismuth, a PPI that reduces stomach acidity, and 2 antibiotics. Another combination has pantoprazole, which reduces stomach acidity, and 2 antibiotics, amoxicillin and levofloxacin. About 3/4 of patients might respond to second-line combination therapy. This slide shows the different kinds of regimens that are used for first-line therapy for Helicobacter pylori eradication. This information is for use by doctors only. This slide shows the different regimes that are used for treatment failure for H. pylori eradication. This information is for use by doctors only. Why does treatment fail in some patients with Helicobacter pylori infections? This is due to antibiotic resistance. This slide shows how antibiotic resistance happens. When an antibiotic is given, there are lots of germs that are killed by the antibiotic, but there are some that are drug resistant, as is shown here, the blue bacteria. Antibiotics kill the rest of the bacteria, causing the illness, as well as the good bacteria, protecting the body from infection. This drug-resistant bacteria is now able to grow and take over. Not only that, some of these drug-resistant bacteria are able to transfer their drug resistance to other bacteria. This happens whenever we take antibiotics for infections. This is how antibiotic resistance develops. And that's the reason for treatment failure with Helicobacter pylori. As mentioned earlier, about 20% or so of patients fail to clear after combination therapy. This usually happens because the Helicobacter pylori is resistant to the antibiotics used, particularly clarithromycin. Patients can also be resistant to another antibiotic called metronidazole. This happens when the patient has taken these antibiotics in the past, which has resulted in the Helicobacter pylori developing resistance. So patient needs to tell the doctor whether they have taken these antibiotics in the past. Clarithromycin belongs to a group of drugs called macrolides, for example erythromycin, azithromycin, and these are commonly used for throat and chest infections. Metronidazole is also commonly used for parasite infections and food poisoning. So patient must tell the doctor whether they have taken these antibiotics before. If they have, the doctor will not use these antibiotics in the combination therapy, as the Helicobacter pylori could be resistant to these antibiotics. Also, the patient needs to tell the doctor whether he or she is allergic to any antibiotics. The patient needs to be aware of the following points during treatment. It is important that the medicine is taken on time and no dose is skipped, otherwise the treatment could fail. Diarrhea and stomach cramps are common side effects. With metronidazole, one of the antibiotics, it commonly causes a metallic taste in the tongue, nausea and giddiness. And bismuth might make the stools black. Also, alcohol should be avoided when taking any antibiotic. After the Helicobacter pylori has been eradicated or cleared from the stomach, the chances of reinfection vary from one country to another, but are generally low. Some studies show that the chance of reinfection is less than 2%.